Well, good afternoon, everyone. I'm Gaye Adams Massey, CEO of YWCA St. Paul, and on behalf of the entire YW team, I'd like to welcome you to the Equity and Justice conversation this afternoon. We'll be talking about the impact of COVID-19 on women, and I want to thank you for taking time to join us this afternoon. COVID-19 has had a disproportionately negative impact on women, particularly women of color, in areas such as mental health, workplace disruptions, and just the pressures of daily life. According to a report from the Center on Women, Gender, and Public Policy at the University of Minnesota's Humphrey School of Public Affairs, women in Minnesota are highly represented in many of the high-risk essential jobs that continue to operate during the pandemic. About 40% of Asian women, 37% of Native American women, and 30% of Somali women in the workforce fall into this high-risk category, according to this report. And in addition to the higher risk for exposure to COVID-19, women were also disproportionately affected by layoffs during the pandemic. Statistics show that workers most adversely impacted by COVID-19 were also the ones most likely to receive low wages and few benefits, such as employer-provided health care. Many of these populations are also more likely to live in multi-generational housing, which created more stress for essential workers worried about possibly spreading the virus to other family members, older members, or children with whom they lived at home. And with so many of our kids involved in remote learning last year, the need for care for children at home skyrocketed during the pandemic. Men and women did not split that burden equally. Globally, women took on 173 additional hours of unpaid childcare last year, compared to 59 additional hours for men, according to a study by the Center for Global Development, a nonprofit, nonpartisan think tank. These negative effects birthed a new term, she-cession, coined to encompass the acute negative setbacks the pandemic has had on women. While many of us were fortunate to retain jobs and work from home, so many women were not and are still being adversely affected by conditions created or exacerbated by COVID. So we're fortunate to have several experts with us today to share their insights on the challenges facing women and what actions, strategies, and solutions are necessary to help ease the burden and support women at home and in the workplace. I'd like to introduce our wonderful panelists this afternoon. Ling Becker first. Ling is the Director of Workplace Solutions at Ramsey County. In this role, she provides overall vision and leadership to more than 80 department staff, and that staff provides workforce development services for job seekers and businesses throughout Ramsey County. Prior to this, she served as Executive Director of the Vadnais Heights Economic Development Corporation. Ling has also been the principal of her own consulting firm focused on local government and nonprofits. Cisa Keller is Senior Vice President for Early Childhood Quality Development at Think Small, an organization that provides services, resources, and advocacy for early childhood education in Minnesota. Cisa has over 15 years of experience in early care and education that began in the classroom and has grown into an expertise in early childhood policy. Prior to joining Think Small, she was the Director for Government and Community Relations with the New Horizon Academy and an adjunct professor at Concordia University. And last but certainly not least, Kathy Duffy is a registered dietitian with a master's in public health nutrition from the University of Minnesota and a bachelor's degree in nutrition science from Michigan State University. She has more than 20 years experience in WIC, Women, Infants, and Children, in the WIC program, supervising teams of nutrition educators and coordinating multiple program areas, including high-risk counseling, nutrition education, reporting and data analysis, the Farmers Market Nutrition Program, and staff training. She currently works for St. Paul Ramsey County Department of Public Health, managing the WIC program. Thank you, Ling, Kathy, and Cisa for joining us today. I've been really looking forward to this conversation. And to those of you listening, a following this conversation, we will open it up to any questions you may have. So please put those in the chat as we go along, and we'll address as many of the questions as we can. So I'd like to start with a few questions that will help us understand some of the key ways women have been affected by COVID-19. We know there have been significant effect on workforce participation, on mental health, on stress levels, and that there have been insufficient support for women, particularly mothers. Cisa, can you talk to us a little bit about the child care landscape in Minnesota and how it's been affected by COVID-19?
Yeah, Gaye, and thank you for having me, and excited to have this conversation with everybody. So childcare, kind of nationwide, we are currently in a situation, even before the pandemic came about, in which we do not have enough sufficient childcare to really meet the needs of families. And as we think about, moms going back to work, childcare is the number one thing that is often keeping them out of the workforce. So even before the pandemic, we had significant what we call childcare deserts. In Minnesota, we see childcare deserts in just about every community in greater Minnesota, in the metro here, in which there is just not enough childcare options for families to choose from. And as we introduce elements of quality, really making sure that those childcare programs have, kindergarten readiness best practices, there are even fewer options. When the pandemic came along, we saw those options reduce significantly. Now, I will note that we did better than many other states. In Minnesota, I'm very proud to say that as a community, we really identified access to childcare as an essential element to getting through the pandemic. And so the governor actually said that childcare was an essential service. And so we were able to keep our childcare programs open, unlike other states that really shut them down. And what they are seeing is now, after being shut down for a year, they are not coming back. So we did keep our childcare providers open. So there was access. However, we did reduce the amount, for safety reasons, the number of children that providers could actually care for. And so that really did have an impact in many, many communities. And in addition, I'll just say that so that was for families that are looking for childcare. We also know that childcare itself is a women-dominated field. It is predominantly women that are doing this work. And so as we think about the industry and childcare providers themselves, childcare educators themselves, during the pandemic, they were really carrying the weight of keeping our communities working on their shoulders, while at the same time trying to make sure that their own families were safe and secure. They were trying to care for all of our families and keeping them safe and secure. And for many childcare providers, they were also doing this not only during the pandemic, but in many of the neighborhoods that saw a lot of civil unrest after the murder of George Floyd. So the mental toll, the financial toll that these women were carrying was significant, and we saw a lot of that. So that's really pre-pandemic. We had a significant issue and enough childcare. Now today, it's not much better. We're better than some states, but we still have a significant issue in which we don't have enough childcare available for working moms, working families, and the childcare industry itself is really struggling and could really use a lot of support to be able to be a viable option for our communities.
Cisa, has the American Rescue Plan that was put in place by the Biden administration and Congress had any impact on this situation?
Yeah, and actually, I'm going to back up even a little bit before even those. We saw the state kick in very quickly back at the end of the 2020 legislative session. One of the things that came out of that session was a significant amount of grants to support childcare providers and keeping their doors open. Again, when we saw the reduction in the number of children they could see, childcare is a very hard business model. And so not being able to serve children really was going to to impact those businesses being able to stay open. And so we saw public and private support in trying to support childcare providers all the way back to last, March and May kind of time frame. For example, even Think Small put out, our own private dollars to kind of seed some of that. And so we saw that continue with all of the COVID relief funds that have been coming out of the Biden administration. Each one of them has had substantial funds that are dedicated into supporting the business of childcare and really helping to make sure that childcare providers are able to keep their businesses afloat and keep them running so that our families do have the options that at least existed before COVID.
Oh, that's great. Kathy, you've worked for a long time with the WIC program. Some in our audience may not be familiar. Can you just give us a little background on the program?
Oh, absolutely. WIC stands for Women, Infants, and Children, and we're a public health program, a public health nutrition program that serves pregnant women, breastfeeding and postpartum moms, and infants and children until they turn 5. And what brings families into our clinics is the food that they get. So every families get a card that they can take to the grocery store to purchase very specific nutritious food. So they get dollars for fruits and vegetables, dollars for whole grains, dollars for dairy or soy products, and things like that. So that's what brings families into the clinic. But then everybody who comes into the clinics gets health screening. We do heights, weights, and hemoglobins on everybody, chart children's growth, make sure pregnant women are gaining weight the way they should be. And then we provide nutrition education to families based on what their needs are. So we teach about infant feeding. We teach about trying to make mealtime with toddlers and preschoolers pleasant, how to help families feed their children a little more healthy. And we provide breastfeeding support to families that choose to breastfeed. And then we connect families to other resources that are out in the community. So we connect to other social service resources that families would be eligible for. But then we also try to connect families with educational opportunities. We work with the libraries to connect families to programs that are geared towards families with young children, and work with programs out in the community that are geared towards kind of keeping families active in the community.
So with as many women and families as you're working with in the community, what impact have you seen COVID have with those you're serving?
I think the biggest concerns that we've seen are just mental health concerns due to the added stress and anxiety that families that have been brought on by the pandemic and parenting young children. And we see it across all of the families that we're serving. Bringing a new infant home from the hospital for the first time can be stressful and vulnerable during the best of times. But now our families are doing this during the pandemic. They're leaving the hospitals faster. Maternity stays have been shortened. They haven't been able to have the support while they're in the hospital that they've been able to have during non-pandemic times. And then they're going home to an environment where some of those usual supports that were in place aren't there. Families are staying away due to fear of spreading COVID to the infant. And some of those structural programs that are in place to serve families in our communities, some of them are still functioning, but they've had to shift. Like our WIC program, we've had to shift so that we're not putting people at risk of catching COVID. And so we're still providing services, but we're doing it over the phone. And so we've figured out ways to still get the foods to the families, but those connections that we're making to families are over the phone. And so it's not the same as when you're visiting with somebody face to face. It's much more difficult to get to the place in a conversation with a new mom where she might open up to you about struggles that she's having or concerns or depression or anxiety that she's dealing with when it's just over the phone. And so I think families are suffering in that sense. And it's not just WIC, it's all of those social programs that are in place. The family home visiting nurses over the last year have been seeing people via video chats. ECFE hasn't been doing all of their services face to face. So all of those support structures that are in place. And then even the same thing goes with those families that are just raising young children, toddlers, and preschoolers. I've told my husband multiple times over the last year, I'm so glad that our children are older right now. I can't imagine being home 24/7 alone with toddlers and preschoolers over the last 18 months and not having any of those social outlets where you can get out of the house and have them interacting with other people.
I'm with you on that. Ling, you've been leading workforce solutions for a while. Can you just share with our audience a little bit about the workforce development services
Sure.
the organization provides?
Yeah, thank you. Thanks, Gaye and the YWCA for having me. I'm really honored to be here today. Yeah, so Ramsey County provides workforce services for a wide array of folks, really the whole continuum of job seeker. There's people that just are looking for some quick help, like at a careers lab, and just need some resume support. We've continued to stay open during the pandemic in some of our service centers and libraries, but we also serve a lot of residents that are actually enrolled participants in specific types of programs for job seekers who have some type of barrier or some sort of negative impact on their life. So for example, all those folks that you've heard were on unemployment, they all qualify for what's called a dislocated worker program. And so those are programs that we run or we work with our contracted partners to provide to the community. And then, you know, in all the different parts of the continuum or ecosystem, we also serve youth and young adults who have barriers, whether it's income barriers, whether they've been involved in different county systems, such as our, you know, criminal justice system, or maybe they were in the foster care program, you know, different barriers for young people. And then lastly, in one of our largest populations of folks that we serve are generally women, but they can be families and men too, who are on the Minnesota Family Investment Program, that MFIP program. So parents with young children, and mostly women that we serve in those programs. And so you can see the whole gamut. I would say we've been spending a lot of time right now also serving businesses who are in need of workers. We host job boards, and we also host a lot of, you know, virtual or even some in-person events to connect basically the supply and demand, you know, equation of job seekers and employers.
Okay, thank you. That's really helpful. You know, we've been talking about some of the statistics around the impact that COVID has had on women in the workforce, but can you share what you've seen in Minnesota and
Sure.
Ramsey County in particular?
Yeah, let me just share a couple of nationwide statistics too, because I think they just demonstrate the significant impact COVID has had. You know, before COVID-19, I would say nationally, and in Minnesota included, Ramsey County included, women were starting to make some real progress in the workplace. You know, between 2015 and 2019, the number of women in senior VP positions jumped like 5%, which is really significant. And many things happened to sort of encourage that over those years. And even we saw some significant increases in C-suite. You know, that's actually those are unique demographics in our population, but very significant nonetheless to have women in significant leadership roles. I would also say that pre-COVID, our research that we've looked at showed that women were generally not opting out of the labor force any higher than men pre-COVID. That might have been something we might have, you know, had we had a trivia question, we might have guessed that women did, but they did not. And I thought that was fascinating. So in every year, you know, kind of pre-pandemic since, well, 2019 and 2018, the average attrition rate for most companies for people leaving the workforce was actually higher for men than women. And so women were, again, you know, making some strides, stabilizing, and some of this has to do with other supports that maybe were in place, but really, you know, seeing some movement in terms of economic stability and work outcomes. But COVID-19 has certainly created some major setbacks. And for all the reasons you all have mentioned around the demands of moms, especially of like when there's a two-person household, if the kids have needs, it generally fell on the women, you know. And what we found that there's actually three groups that had the largest challenges, and those were working moms, women actually in senior management positions, because you can imagine those jobs were highly demanding and something had to give, and also Black women. And so these are, you know, three quite different demographics, but we also are looking at where Black women were mothers and where Black women were, you know, potentially in those C-suites. So the layering of impacts, especially if, you know, you have multiple things going on. But In terms of Ramsey County, many people have heard me talk during the last 18 months, have heard, that this has not been a pandemic that has been equal for the people it's impacted. Young people, less educated, and women and BIPOC communities have been very disproportionately impacted. Women tended to be in the industries that have been most impacted, particularly in those early days of the pandemic, when you look at personal care, food prep, even some healthcare at the very onset of the pandemic, and then certainly retail. And they also occupy a lot of those low wage jobs, which are in those industries. So women, 48% in Ramsey County actually are in jobs that pay $30,000 or less. And those jobs were particularly vulnerable to the pandemic. So for all those reasons, I think women have really had to recalibrate some of their dreams and aspirations around themselves. And we can talk a little bit more about that as we talk about the future. But I cannot understate the tremendous economic, kind of backward loss and scarring that's kind of probably happening to the women in the workforce. So
it's so sad to hear that women were already behind men and finally beginning to make some significant progress. It's hard to have a setback quite like this. One of the things that makes it possible for women to be in the workplace, women with families, is childcare. So Cisa, I want to ask you a little bit about your thoughts about what we should be doing as a community to help support improvements to childcare affordability and accessibility in Minnesota.
Yeah, I think that's a great question. Putting on my policy and my advocacy hat, what I think we are all coming to recognize, what became very apparent during the pandemic, is that access to childcare really is a public good. So it doesn't just affect one family, it really affects an entire community. It completely affects the business community. If a parent, a mom, doesn't have access to stable, continuous, affordable childcare, they're not able to really show up at work and be there fully present, which has an impact on business, which has an impact on community. And so access to childcare is not just for young families. It really is all of our responsibilities and needs to start being thought of as a public good, just like access to good roads and access to public services like the library and things like that. And so I think that's one, is just recognizing that access to childcare really benefits all of us. And then two, I think the other element that makes it challenging is that most people really only have to worry about childcare for about 5 years. Right. And then they move on and they can start thinking about all the other things they need to worry about. But access to childcare is in those first 5 years of a young family's life. It's often when they have the least amount of time and the least amount of resources in which they can really share their stories with others. But it is so essential that we really are sharing those stories, that our local legislators, both at the state and federal level, understand what the impact of having access to stable, affordable, quality childcare, how important that is to you. And as Kathy is talking about, access to WIC, access to home visiting, all of these services, often I think kind of get brushed aside, is not really that important, right? Like that's really the role of moms. It's not something we need to invest in on a regular basis, like some other industries that maybe have a lot more results. So talking with your legislator, really making sure they understand how you are as a parent, as a caregiver, as a grandparent, as a neighbor, how you know that childcare is really benefiting somebody and what is working well. So if there's a particular program that has really supported you, again, I'll use Kathy. If WIC has really helped you, make sure your legislators know that WIC has really supported you. If having access to early learning scholarships has really supported your family, make sure that that your legislator knows that. Because legislators, this is where I'll put on my advocacy hat. Legislators don't hear from very many of their constituents. In our advocacy trainings, we kind of ingest, but it's really, there's a lot of truth to it. If a legislator hears from 2 or 3 people on one issue, it becomes a very important issue because they just don't hear from very many people. So make sure that you're talking with your legislators, interacting with them, even if it's just a quick email about the struggles you're having or the successes that are really supporting you and helping you. So
that's really helpful and really good guidance. So Kathy, I'm going to ask you something similar, based on what you see in your work. What are your thoughts about things we can do in our communities to ensure necessary supports for women and their families?
I'm going to echo what Cisa just said, is talking with legislators about priorities. I think one thing we've seen during the pandemic is that there has been a lot of support for programs that are supporting families. There's been a lot of increases in SNAP benefits. We've seen some increases in flexibilities in WIC services that are provided. Making sure that momentum continues and it doesn't stop when the pandemic stops. There's a lot of support right now at the national level for WIC to expand it to kids who are 6 years old and to serve women for 2 years postpartum versus now we just serve them for 6 months. Making sure that those conversations continue into the future and don't stop as soon as the pandemic stops. And then I think the other thing on a more individual level that people can do is, if you know families that need support, to make sure that they are connected to those services, because these services are available in the community, but we're not reaching all of the families that we could be reaching. And so, if you do know families with small children, trying to get them connected.
Yeah. Thank you. One of the things we know really happened is that a lot of women lost jobs, and they tended to be low-paying service jobs. And one of the things we know from the data is that many of these jobs aren't coming back. So Ling, I'm going to ask you if you can talk a little bit about the future of work. What changes do we see on the horizon, and what needs to happen to help women regain lost ground in the new realities of work?
Yeah, there's so much to talk about here, but really what we have seen in terms of the jobs that were most vulnerable, these aren't new jobs or new industries that we recognize that needed some pivoting. I would say our 5-year forecast, based on even at the end of 2019 pre-pandemic, we knew that retail jobs, some restaurant type jobs, warehouse type jobs, very low entry level jobs, right, in our community. They were, in 5 years from now, we already predicted that a lot of those jobs were going to shift due to the way we shop, due to automation, due to things that, what COVID did was basically bring 2026 or 2027, like right here at our doorstep in terms of the way we work. Some people will say, well, there's still a big demand for restaurants and some of those workers right now. And that's certainly true. There's actually a shortage of some workers working in hospitality right now, but that's a short-term thing. I really do think businesses will take the time at some point to recalibrate their needs, and there will be a change in business models, and those jobs are eventually going to go away. So I guess what I would like to see more opportunities for women is their ability to invest in themselves, especially in those lower paying jobs. And that takes time, and it takes money, and it takes energy, and it takes attention. And women obviously right now are completely distracted in a way that I don't, I mean that in the best sense of the word, like distracted in terms of caring for their family and keeping everybody, clothed and going and their basic needs met and all these things. And they're not thinking about themselves. And so the challenge of women kind of trying to retrain and reskill themselves is very difficult right now. And actually these times, especially during the unemployment kind of wave where a lot of people were on unemployment, that actually is a wonderful time to do some training, right? Because you might have been able to get some unemployment benefits and kind of take that time and maybe take an online class or do something. Well, a lot of women didn't have that opportunity. Sure, unemployment helped a little bit, but you didn't have capacity to really think about investing in yourself. And I worry about, as we're shifting now into another school year with just all the uncertainty, you know, the women just are always going to put themselves last on the list when there's other people to care about. And so there's just so much unknown. And I think even with the future of work, people say more people working at home, more people telecommuting. I think while there's some valid arguments, there's some work-life balance that brings. We haven't figured that out yet. As I'm sure all of us who do this right now, doing a lot of work at home, I feel completely out of balance. Like my schedule's crazy. I mean, that hasn't garnered me any work-life balance. And we haven't, and as a society, we haven't figured that out yet. And so while people are trying to sell this new future of work, even for middle-class women and upper-class women, you know, in more, you know, jobs you can work at home, I'm not quite convinced yet that we are having good separation and that could be a possibility in the future, because work demands those things of you. And I call it kind of we home at work and not work at home, because it's now here, you know? So, I mean, there's hopefully you guys laugh, but I think there's some truth to it. And so while we kind of take some hope in, is there some work-life balance at the end of the tunnel for us? I'm not convinced we're going to get there, you know, as workers. So we'll have to see.
Yeah, that's a tough one. You know, I look at you know, so many workers move to remote work and working at home. And you read so many articles about how that opportunity to work on a remote basis or to work on a hybrid basis is something employers are really going to have to support in order to keep their best workers. And I believe we'll have to see some more workplace flexibility. But when I think about, does that mean we will have better support for women in the workplace or not? You know, you might assume that means that greater flexibility provides better support for working women, working mothers. But is that really necessarily the case if you don't have the childcare supports and other things in place? What are you all thinking about kind of this new normal of remote and hybrid work?
I mean, I think time will tell, and it'll depend on your ability to carve that out for yourself a lot, and you're working with your employer or supervisor. But I mean, I'm sure if any of you have kids, like I've literally been in the same room with my husband sitting next to each other, and they always come to me. So if there's two people working in this house and the doors are shut, it's going to be mine that gets knocked on, right? And so there's a certain level of stress that just comes with being a working mom, that you're trying to do it all. And kind of when it converges all in the same like ecosystem in place, it's just like a little harder to sort of put it into some compartments, I feel, you know? So again, I feel like the jury's out on like whether that's possible for women, or if it's just going to add a new level of stress and guilt and challenges. But yeah.
Yeah, I can see it in the childcare, you know, arena. There's, you know, again, so we've got the elements of these are also working women and trying to figure out, well, like, what does this look like now? What are the skills to think about? So, for example, one of the things we're really starting to grapple with is often people got into childcare and this was what they were going to do for 20 to 30 years. And now we're starting to rethink about like, well, maybe this is just something that you do for 5 to 10 years. And what are the skills you can take from this experience into your next potential experience, right? And so thinking about that more long-term kind of trajectory. But then within childcare, we're also, again, back to supporting families and supporting moms, really thinking about what does family engagement look like, you know, as we're changing the dynamic in which the way that we interact with everybody, family engagement needs to change as well. And so what are the needs families need and where can childcare fit into that and really supporting them? So you know, one of the things that we saw huge shifts in the use of childcare during the pandemic was actually more school agers, because schools, you know, we're all distance learning, more school agers were choosing to go to childcare than we had ever seen. But they weren't there for before and after school, they were there for school. And so what were the supports we needed to now be doing that we had never done before as a childcare field? And so really trying to look about that family engagement components as well, and how can we support families.
it's really going to be interesting to see how things evolve on this. And I hope, the concerns for and supports for women are at the forefront in policymakers and employers' minds. Ling, you said something earlier that I want to focus in on a little bit, and that's, we've been talking about this through a gender lens, impact on women, but what if we overlay a racial lens on that? How do you see the impact of all of these things we've been talking about on women of color in particular?
I mean, I'll just jump in real quick around work. There's a lot of systemic racism in the workplace, and for women of color to move up the corporate ladder, you have to really kind of go the extra mile and have people see you do that work and kind of be able to demonstrate that. And there's a certain expectation and of performance, and I think in the virtual world, some of that gets harder and harder for people to sort of prove in a virtual world, right? It's how many hours you kind of put in the office. Are people seeing you there? So I just feel like those problems that I think, and this is what I tell employers all the time when they struggle with hiring right now, the same problems that existed pre-pandemic in terms of barriers that we have around people being your company culture, or you helping people be successful, BIPOC women in particular, be successful in your corporate structure. Those same things exist today after COVID. You know what I mean? It's not like I think sometimes people think COVID sort of made some things worse, made some things go away. It just was kind of a blip in time. And I mean that in the best sense, but it's almost like there's this isolation of all these COVID impacts, but all the problems in our society just basically are still around, So systemic racism in the workplace is still a problem. Gender inequity, lack of family sustaining wages, like all these things are still here. And COVID, if anything, made them worse. But a lot of people like to point to, as we point to problems in our community right now, say, well, that must have been caused by COVID. And I'm like, no, actually, that was here before COVID. You just have to get real with it. I mean, it's been a problem. It's still a problem. And we have to start addressing it. If anything, a lot of it got worse due to COVID.
And I'll just add one more to Ling's list of things that already existed and honestly are still here and potentially got exacerbated by COVID. As we think about working moms, Minnesota has one of the largest achievement gaps between children of color and white children. And so that is still very much present. That is very real and very here today. And we, one statistic we can just put out there is many of of adverse childhood experiences, ACEs. And what we can tell you is that COVID is now an ACE for every child in the world. Every kid just got an additional ACE. So already existing situations have been exacerbated in this space.
One of the things I've been really worried about is the impact COVID and remote learning and some of the struggles so many kids had staying engaged with learning in the past year, what that's going to have on that achievement gap, and what that will mean in terms of lost opportunity for our kids. It's a daunting thing to think about. And are we going to really invest to help kids catch up and get to where they should have been? There's a lot here that we need to address, and for folks listening, so many areas to choose from, areas of interest where you can advocate or raise concerns with legislators, civic leaders, and others to focus their attention on these areas of real need. So I want to give each of our panelists an opportunity to share any last thoughts or insights, things we didn't cover you wanted to make sure we mentioned before we open the floor for questions.
I'll just say one more thing, Gaye, based on what you just said. I know this is something dear to your heart too, but we didn't talk at all about kind of our young adult population or our kind of graduating kind of high school kids. But I really I've been reflecting on, in 11th and 12th grade, we do a lot of work with schools to try to work on career exploration. And, you don't get to do 11th grade again, and you don't get to do 12th grade again. And so those kids that normally we would have put in an internship at an auto, place to explore that, or be work in a manufacturing, or, they didn't get some of that hands-on learning that I feel is so critical as you're doing kind of figuring out your next steps. And so I think one area of particular need, and where as a county, we've kind of quickly tried to invest some resources of our ARP dollars, is really these 18 to 24-year-old young adults. If they've kind of graduated and are not connected to some sort of positive education system in some way, they're just floating out here trying to figure out what to do with their life. And it's just, with the COVID impacts, I just feel like it's a very tough place to be, trying to figure out what you're going to do next. And so I really do worry about, and we know COVID really impacted our younger BIPOC population very, very disproportionately. And they're the first ones to lose their job, and usually the last ones to get one, when they're looking for some of those roles. So
yeah. Thank you so much for raising that, Ling. That is such an important point.
Yeah, I'll just add, as a closing kind of thought, I think I'm often trying to think about how we can turn this into an opportunity, right? And I think as we look back over this last year and a half, the needs of young families, the needs of mothers, the importance of childcare, those became front and center for almost every person in this country. And so really it's on us to make sure that that focus remains there, and that it just doesn't kind of slip to the back of the line once we kind of get back to normal, whatever that looks like. And so really, it is on us to keep that front and center and make sure that we are continuing to really address these things. From a childcare perspective, I have to say, it's really exciting to know that when in Congress and they're having an infrastructure conversation, the words childcare are being used over and over. That would have never happened 5-10 years ago. But we got to keep the pressure on to make sure the issues of women, the issues of mothers, childcare, that those continue to be priorities.
Cisa, that's such a good point. And one thing that I just wanted to ask you about is, I've always thought one of the reasons we had a shortage of childcare is the pay scale for childcare workers. It's difficult to make ends meet on some of the wage levels that childcare workers, who are doing some of the most important work that happens in our community, but they're paid at a very, very low level. Do you think that's one of the, how can that be addressed? How do we influence that, but still keep childcare affordable for families?
Yeah. This is actually, I'm looking to Ling. This is a conversation we have on a regular basis as we think about those young adults and looking about potential careers. Is early childhood one we want them to go into, knowing that we have these significant issues around compensation? And so, there is, this is an issue that lots of people are trying to focus on. What is very clear is we cannot put this on the backs of parents. Parents cannot afford to pay any more for childcare. So again, one of the statements I made earlier, this has to be viewed as a public good. And so we need to be looking at what is the public resources that really are going into this space to make sure that, as you said, these educators, our childcare providers, are paid at a level that at least is on parity with a kindergarten teacher. And so we are looking at a lot of different models, but for example, we really should be thinking about early childhood similar to higher ed, in which there is public-private funds that are really going to supporting what that field looks like, versus trying to make early childhood more like K-12, because we do have a mix of both private and public dollars. But at its core, there needs to be a significant, stable, ongoing funding that needs to be into this space to make sure that those early childhood educators are getting paid what they deserve, to be taken care of. Honestly, our most important resource as we think about the future of our state and our country, our children are truly our most important resource that we need to be investing in. So yeah.
Absolutely. Very well said. Kathy, did you have anything else you wanted to say as we close up our conversation?
You know, just to build off of what Cisa said, it's to make sure that this momentum we have, where this focus and at the federal level is on families, that we keep that focus there, and that we encourage legislators to move some of these things forward. I do have some concerns as we move through the pandemic about the long-term impact we are going to see that we have no idea about yet. That's going to be on these young families.
Thank you all so much for these insights. I'm wondering if we have any questions from the audience. If you do, please put them in the chat. We're glad to answer any of them. And Nikki and Dina, I would ask you, if you have any questions there to share.
We don't have any questions posted. I did share a link to YWCA St. Paul's youth programs, where we support high school students and young adults on youth employment. And Ling put the early childhood education workforce information, labor market information in the chat as well.
Wonderful. Well, thank you, Ling, Kathy, and Cisa, for providing such great information this afternoon. You've given us a lot to think about and really good guidance on how we can make a difference on these issues by getting to our legislators and really keeping a focus on these important issues for women. I really want to thank you for participating in the conversation, and I want to thank all of you who are listening for joining us today. At YWCA St. Paul, our mission is to eliminate racism and to empower women. And one way we do that is by facilitating meaningful conversations like the one we just had within this community. I hope you'll take a few minutes and visit our website at ywcastpaul.org to learn more about our work. I also just want to note that we recently launched a new 21-day racial equity and social justice challenge, and you can find more information about that on our website. I hope you found this conversation informative and inspiring, and that you feel moved to help advance equity and systems change. So thank you again, Kathy, Ling, Cisa, and to all of you who participated today. It's really been an honor to spend this time with you. Thank you and good night.